This is Stephen, and in this video we will discuss M mode. Let me start by drawing out our standard parasternal long axis view. So you have your left atrium that empties blood via your mitral valve into your left ventricle. You have your aortic valve and aorta. This is the wall of your left ventricle. And up here you have your right ventricle. All right, with M mode, we are actually slicing right through the heart and looking at a line. And so we can slice through the aortic valve, we can slice through the mitral valve, or we can slice through the left ventricle. And we will look at each of these in turn. 1, 2, 3. The benefit, or the reason we use M mode, is that because you're just looking at a line rather than a whole 2D picture, is better temporal resolution. And so with M mode, you can get about 1,000 frames per second, which is about 10 times what you would get with your traditional 2D echocardiography. So you're just looking at a line, and you can see the timing of events along that line about 10 times better. So what do you see along these lines? Well, let's start with number 1, slicing through the left ventricle. So you'll see something like this. You'll see, I'm going to draw 3 cardiac cycles here. And let me add a little bit of thickness in here. And I'll walk you through what we're looking at. So what you're seeing here, this space inside here is the left. Let's go back to our pen here. This is the left ventricle, this cavity. Over here, this is actually the right ventricle, this cavity here. So left ventricle, right ventricle. And you are looking at the posterior wall, of the left ventricle here, and you're looking at the septum right there. You'll notice that both walls of the left ventricle are thicker than that of the right ventricle. And in terms of the timing, when all of the walls come in, this would be systole. When they all open up, this would be diastole. Again, systole, diastole, systole, diastole. This would be normal M mode of the left ventricle, right? We see both walls of the left ventricle coming in together, coordinated. We see that the right ventricle also comes in, and then all 3 walls expand appropriately during diastole. Okay, that's number 1. That was number 1. How about number 2, where we're slicing through the mitral valve? Let's scroll a little bit down here. So if we're slicing through the mitral valve, we will first see the same, see a similar, so this is our, I'm going to draw our LV all first, something like this, and something like this. Add in our RV for completion's sake up here, even though that's not the focus of this. Let's add a little bit of thickness for the left ventricular septum, and then also for the posterior wall of the left ventricle. And our focus, the area of interest, is actually the mitral valve in here. What does the mitral valve do? Well, during diastole, the mitral valve opens up so that blood can flow into the left ventricle. And so you see that like this. It actually opens up in an early period and a late period, the E wave and the A wave. And then the mitral valve will be closed during systole, and diastole it'll again open up, be closed in systole, and right at the end here it would again open up. I'm going to add in this cycle over here. Okay, so again, let's label what these would correspond to. So this is the posterior wall of the left ventricle. This is the septum. This is the RV. And then this is our anterior leaflet of the mitral valve. Mitral valve, we'll call this the anterior leaflet, and this is the posterior leaflet. And you see that they're staying closed in systole. They're closed in systole, open in diastole, closed in systole, open in diastole, closed, and open. This would be your normal M mode of the mitral valve. If we go back to our drawing from the beginning, we're now going to look at number 3. We're going to look at the slice that goes through the leaflets of the aortic valve. Let's now look at the same for the aortic valve. So this will be number 3. What do we see? Well, you're going to see your aortic valve. This time I'll just start with the aortic valve. You'll see it open in systole, and then you'll see it closed in diastole, open in systole, closed in diastole, and open in systole. You'll see the walls of the LVOT going into aorta. Actually, this will be the walls of the aorta on either side. And then technically up here, this would be your right ventricular outflow tract up here, and your left atria would be down here. We don't see the ventricles if you look at where we were slicing. And again, so in systole, you see that the valve is open, so the blood can be ejected out of the left ventricle. During diastole, the valve is closed. Systole, open. Diastole, closed.